tell me your name and date of birth. Carrie Smith, 7/17/60. Perfect. So today we're going to be inserting an indwelling catheter, all right? Before I do anything, I want to assess my patient. Let's see what's going on before we start. All right, I'm just going to take a peek here. The peri area. So I'm assessing for redness, swelling, any signs of infection. If it was infected, we would not want to put the catheter in. It would just cause more pain and irritation and more infection. But everything looks good. Carrie says there's no pain or anything like that. So now we want to position Carrie's legs, and you have the patient help you. Obviously, it's easier on a real person. So just kind of spread their legs a little bit. Make sure you have easy access to everything. Okay, looks good. And I've also positioned the bed at a nice working height for me, so I'm not straining my back. All right, so now we've positioned our patient, we've assessed the area. Let's open the catheter kit. And there is a 1-inch non-sterile border that we can grab. And we open away from us first, the two sides, and then towards you. Before I did this, I performed hand hygiene. I just have regular gloves on now. So let's get everything set up. I also have a clean working station, and I positioned it so I can reach over and not contaminate anything. So we have our sterile gloves. And we have our little pad that we need to put under our patient. Again, 1-inch border that we can touch. At this point, I'm going to ask the patient to bridge and help you position this pad under their bottom. And this will be okay because as soon as it touches the bed, it becomes non-sterile. So in real life, they would help you bridge and get it under there. Okay, so can you bridge? Perfect. All right, looks good. Now we have the fenestrated little guard. This just helps to prevent infection. We'll also place that right there. Same with the 1-inch sterile border, non-sterile border you can touch. Okay, so we have set our patient up for success. Let's place everything here. Okay. So again, my patient doesn't have any allergies, so we can go ahead and get started. I'll take off my normal gloves and I'll put the sterile gloves on. So again, the 1-inch border we can touch. Okay. So open. Start with your non-dominant hand, which would be my left hand. And we can touch from the inside and not the outside. And then with the sterile glove, you grab underneath the cuff and place on your dominant hand. Now we grab this, we can clean everything up later, just toss it to the side. Okay, leave our catheter here. We have our little lubricant. Set it up, open it, set it up in our box. And we have our flush to infill the balloon. Place that in here.
You can do that now.
Just gonna do it at the bed. Take this off. This is all sterile inside the box. Sterile. Okay, so I'll place this in the loop. taking any samples, so we don't need this. And I have my cleaning sticks that I'll place in the box. And then I will get the flush set up. Okay, now I carefully transfer to the sterile field on the bed. And I will take my iodine swipes, open them up. There should be 3 in here. And now with my non-dominant hand, I'm opening. So you start with the farthest away and work your way in toward yourself. So we go from the top to the bottom, 1 swipe, pass it away. Grab a new stick, the middle, from top to bottom, 1 swipe, throw it away. And we grab our last swab, closest to you, top to bottom, throw it away. Okay, and now you can go ahead and insert the catheter. This might be a little painful, so bear down. It will be lubricated. I didn't put any water on it.
And
That's why.
No, you're good. You're doing wonderful.
Normally it would, in a perfect state, it would go in easily. And you will go a couple of inches until you get a urine flashback. And then after you see the urine flashback, you go in about 1 to 2 inches further. Okay. How is that? Is that comfortable? Can't feel it? Okay, good. So after that, you want to hold with your non-dominant hand. The packaging will tell you how much fluid to insert. So we'll just do about 5 mils. But to double check that there's enough liquid, the balloon is filled enough, just give it a little pull. It's not going anywhere, so it's probably filled enough. We take this off, we throw it away. Okay. So now we can set this up, attach it to the leg, a little tape, and we want to make sure that the collection bag hangs below the bladder, and you don't want it on the guardrail because the guardrail can move and it can rip out the catheter. So my education for the patient would be to make sure that you don't rip it out because it will bleed, and to assess for any pain or irritation to come get me right away. So now that we've attached that, rip this off, throw everything away. Return the patient to a comfortable position. There we go. And take off your gloves. Another point of education we can talk about with our patient is cleaning and pericare with the catheter in. So you would get a few fresh towels, soap and water, and to clean it, you would instruct them with a glove to grab right by the base, get a folded towel, soap and water, do the pericare first, outside, 1 swipe, new side of the towel, middle, 1 swipe, new side of the towel, closest to you, from top to bottom, new side of the towel, and then you would get a new side of the towel, soap and water from the base, clean the tubing down. And then you would repeat the same steps with a dry towel so that there's no moisture that could cause infection. Okay. All right, I would document hand hygiene, return the patient to ground level, and then give them the call light.